Hi, my name is Jason Buffington. I'm the Data Protection Senior Analyst at the Enterprise Strategy Group. And if you've been following my blog on technicaloptimist.com, I've been spending the last couple weeks looking at regulatory compliance and contrasting that with operational readiness. Each week I've been spotlighting a different major set of industries and the regulations that may apply to them, and this week we're looking at healthcare. When you're looking at healthcare regulations, there's really two major regulations that come into play. One of them is JHACO, J-H-A-C-O, but the other one that more people are familiar with is HIPAA, the Health Information Portability and Accountability Act. It's been around for several years, and in fact, if you've been to a doctor in the last 10 years, you had to sign all kinds of forms saying that you agree with HIPAA policies. But again, the thing to think about here is that HIPAA is around privacy of your data. It's around who can access or not, or one of those A's in HIPAA stands for accountability. Who's allowed to touch it? Who's allowed to see it? The other one's around portability. I want to be able to have that data move in between. For those of you that are a little bit older, you'll remember that every doctor used to have their own insurance forms, and everyone used to have their own claim forms. And the whole idea of HIPAA was around making sure the data would be more easily to move between healthcare providers and pharmaceuticals and insurers and you. So if that's what the data is about, how portable is it and who's allowed to see it, then you have to start looking a lot deeper if you're going to find out about the data protection strategies you're going to need to use as part of a HIPAA mandate. Now, there's a whole slew of regulations around privacy, and in fact, HIPAA comes in 5 major parts. Title II, 2.1 is around privacy. I won't cover that today. 2.2 is around transactions and actually moving the data around. You see the others on your screen. 2.3 for security. 2.4 unique identifiers. Enforcement is 2.5. If I look into 2.3, so security, at least we're starting to get closer to a data protection standard. When you dig into 2.3 and you go far enough, you will find Rule 164.308, which is related to the security standards around data protection and availability. In fact, when you look at 164.308, you'll see Section A, subsection 7 actually does mandate an establishment and implementation of a contingency plan for fire, for system failures, natural disasters, anything that could damage the systems containing data which is being protected under HIPAA. And in fact, there are 5 provisions underneath that are worth looking into. And in fact, you can just go do a web search and find this. But underneath 164.308, Part A, Subpart 7, you'll find there are 5 mandates, including a data backup and recovery plan. What does that need to look like? A disaster recovery plan. So we're going to actually go across multiple sites in order to resume service. What your emergency mode operations is, how often should you be testing, and what your revision procedures should be, as well as how to actually do the data and the application of those critical systems. Where should those be? Where should they not be? If you dig far enough, that's what you're going to find. What you will also find, dig a little bit further. So that was 164.308. 164.310 actually talks about continuity of operations. So in this case, we're talking about business continuity and disaster recovery here, and the idea of improving backup and recovery of those highly prioritized items so that you can actually resume service. That's important because, again, remember, if the data is supposed to move freely between you and your healthcare provider and the insurer, et cetera, if any one of those subsystems is down, everyone else stops. So business continuity and DR is part of that. When you're talking about HIPAA and you're looking at data protection mandates, what's important to realize is the best you get out of HIPAA is the what. What is required, that you must have a backup plan, you must have a DR plan, you must have a testing plan, et cetera. It doesn't really tell you the how. And so as technology increases or changes, you're going to need to figure out what technologies can give you the best operational agility, the best ability to recover operationally, pragmatically. And then make sure that then are you also filling the boxes, not either or, but are you also filling the boxes for those HIPAA regulations as well for the mandates that you saw in 164. Hopefully what you saw is the regulations aren't as specific as you might think, but they aren't as complicated either, as long as you dig in and can find the parts that actually matter to you. Once you found those parts, instead of trying to address regulatory compliance as a separate set of initiatives within your organization, the goal should be to take those compliance mandates and put them into the larger set of what are you accountable for to your executive management. It becomes part of your overall data protection strategy. That allows for not only regulatory compliance and passing an audit, but also the technical agility to actually recover your operations, whether it's across your physical, your virtual, or your cloud-based infrastructures. Hopefully that helps. Come back to my blog, technicaloptimist.com, and find out other regulations that might have similar benefits.